Now let's talk real briefly about oligoprogression. And so our group was one of the first groups that was thinking back in the early 2010s, could we add SBRT to patients that have now progressed, progressed on first-line therapy, systemic therapy, but not progressed everywhere, but in a limited number of sites. And when we added radiation in this single-arm phase 2 study, these patients had a PFS and an overall survival that was significantly better than patients historically who had been on this regimen who received no radiation. So it gave us some confidence to think that, okay, in this other sequencing scenario, that maybe the addition of local therapy may be beneficial. And again, what this study showed is that no longer were we seeing failures where we saw original disease, but only in distant sites of disease. And in fact, now that bottoms report, Astro 2021, is now a paper in Lancet by MSK physicians and by MSK. And it's now shown that there is a progression-free survival when we randomize in non-small cell lung cancer, when we randomize both patients without target mutations and even patients with target mutations. There's a PFS benefit by adding local therapy. So the jury is still out. We're moving and converging on identifying which patients are best going to benefit with radiation in the metastatic setting. But, we need to do better as a field. And what do I mean by that? We have all these studies. Some are showing a benefit, some are showing not a significant benefit. And as a field, we need to understand why we're seeing these different outcomes. And in part, and I think it goes back to the early studies and the differences in outcomes for individual patients in the systemic therapy only trials, there is a significant heterogeneity in patient populations that may be diluting this benefit. And so what do I mean by that? What do I mean is that if you look at this curve, and I drew this out, and that's why it's so squiggly, but if you take this axis and you start from the origin, and you say at that point in time, patients have oligometastatic disease, we're going to give them radiation. I cannot, unfortunately, predict for you which direction your disease is going to go because of such a heterogeneity we see in patient populations. We can't tell you if the disease is going to be controlled and you will not have any disease for 2 to 3 years. I can't tell you if after 6 months your disease is going to explode. Unfortunately, we don't have that predictive capability.